I think the sort of most frequently asked questions when you're first, I suppose any parent who gets a child that has seizures, is what are they? Why is my child having them? So, in terms of diagnosis, and then if we give that diagnosis of Dravet Syndrome or SCN1A, genetic mutation, because we've done that test, then it's a question of what does that mean? What does this mean for their future? So as with most parents of children that have a child with a neurological condition as babies, they don't often present very severely. So you're like, I don't know what's going to happen when they're a child, when they're an adult. So a lot of questions about what the future may hold, which sometimes doesn't have many answers to it. In terms of diagnosis, it's talking about what that diagnosis means in terms of the seizure management, showing them emergency drugs, teaching them about first aid, telling them what sort of treatments we're thinking about, what sort of drugs we might want to try, and the sort of side effects and all those kinds of things. And then I think it's about directing them and signposting people. They ask about information. They want lots of information about what does this mean. And if you let them go to Dr. Google, then they're going to find lots of misinformation as well as really good information. So it's about trying to help them to have enough information that over time they can digest it and look at it. So I think really at the beginning, it's always about the seizures. It's always about what does it mean in terms of this condition thinking forward, and where do I go to get more help.